Can you define what treatment adherence means for someone with MS, and how important it is to to have that in order to get the most out of your DMT?
So adherence means basically you come up with a plan with your doctor in terms of how you're going to treat MS. And so adherence means you're really going to stick with the plan. You're going to take your medication as scheduled and get all your doses in. So that's really what we call adherence. And when I first was involved in MS, treating people with MS, it was hard because we had injectable medications only. And some people did great with them, but some people really struggled. They had injection site pain or wouldn't take it regularly, skip doses, and frequently people would come in and have a new attack, a new relapse, and it wasn't clear if they were really taking their medication or not. So now it's much easier since we have numerous oral agents and infrequent IV treatments, and now an infrequent oral treatment. So we really can find the right regimen for the right patient.
Can you tell us, how do you know if a DMT is working, and how would you advise people who are not seeing success to continue with their treatment?
So it's always important to kind of have an understanding of what these medications do. So the disease-modifying therapies prevent new relapses. They prevent disability progression over time. So a group of people on placebo would progress more rapidly than people on drug. And they prevent new MRI activity. And so they prevent future disease activity. That said, some people have a lot of symptoms of MS. Their legs are weak, their balance is off, they've got numbness, bladder problems. Unfortunately, these disease-modifying therapies aren't going to bring back old function. So, if you're having all these symptoms of MS from old disease, it's not a repair drug. We're working on repair drugs, but they're not repair drugs. So it's important to have, because I've heard many people who started a disease-modifying therapy and they said, well, I'm not better. Why am I not better? And then they get frustrated and discontinue the drug. It's really to prevent future damage. Unfortunately, we do have patients as they age who have had a lot of disease in their spinal cord or brain, and they start to have cognitive problems and more balance problems, and they get frustrated because the medication isn't necessarily, they feel like they're getting worse despite it. But I think off of disease modifying therapies, things may be getting worse a lot faster.
What other things can individuals with MS do to just support general brain health overall?
Yeah, so there's a lot we can do. So, of course, the disease-modifying therapies prevent new attacks on the brain and have shown to prevent brain shrinkage. Unfortunately, all our brains are shrinking as we age, but with MS, this happens at a faster rate. But many of our medications have shown to preserve that, which will help you physically and cognitively. But things that you can do, adequate vitamin D can reduce new MRI activity, so that's important. We do know that if you keep your mind active, so you do intellectual activities, reading, that helps with what we call your brain reserves. Exercise can be shown to help keep your brain plump and keep your reserves going up. So if you're taking hits from MS, but you're doing all these other things, getting adequate sleep, exercising. Smoking is a real negative MS. It causes more cognitive and physical disability. So there are things that you can do, lifestyle things that you can do to really improve your brain functioning.